Hello YouTube, this is Dr. Mark Haverkorn of River City Oral and Maxillofacial Surgery in San Antonio, Texas. I had a suggestion that I do a host throw instead of a voiceover, so just a video of me before the actual surgery video. So that's what you get to see here as I'm sitting in my car. It's about 1 a.m. on Saturday morning, January 11th, 2020, and I just finished this surgery about an hour ago. This patient has a right submandibular abscess. She'd had a toothache off and on for a while, probably a few months at least, and then the last few days it started to get worse, and then in the last day and a half she got some swelling and then trismus, which means inability to open the mouth or difficulty opening the mouth, and that prompted her to come into the hospital where we treated her. So this all starts from a cavity in the tooth. The cavity is caused by bacteria eating away the tooth, and if they eat far enough into the tooth, they'll get into the pulp of the tooth, the nerve right in the middle, and that gives them an easy pathway to travel down the tooth, through the root and out the tip of the root into the bone. Now, once it gets to the tip of the bone, a lot of times the bacteria will just kind of fester there. You can get some chronic inflammation. We call it apical periodontitis, or an apical abscess, apical cyst, apical granuloma. It could be any of those. And that can fester for a little while before it causes a major problem like this patient had. Eventually, that little infection at the tip of the root is going to punch through the bone. In this case, it punched through on the tongue side, went down into the neck, and she got an abscess there. So let's watch the video. The infection is pretty obvious in these pre-op photos. It's that red area on her right chin and neck. Here it is from a different angle. And then we've got one more angle, kind of a frontal view of the neck. Now notice on the inferior part of her neck there's a scar. She's had a total thyroidectomy in the past, so that's what you're seeing right there. Okay, so we're putting the throat pack down. That's just a piece of gauze that's got a marker in it, a radio opaque marker in it that'll show up on an x-ray. You hear these nightmare stories about stuff getting left in patients. That's why all of our rags and gauze pieces have some sort of radio opaque wire or ribbon in them that'll show up on an x-ray, so you can find them if there's any suspicion that you might have left them in a patient. Anyway, the throat pack's down, and now I'm going to make an incision here in the neck. And by the way, the throat pack's just a gauze we put in the throat to keep blood and pus and stuff from running down in the throat during surgery. We're going to use the cautery here to open up the subcutaneous tissues right there. You can see the smoke coming out. And then the tonsil hemostats to just bluntly open up the cervical fascia. Okay, here comes the tonsil hemostat. I'm going to open up the cervical fascia, and then I'm going to head north through the submandibular space, and we'll find the abscess cavity here in just a second. And notice the culture tubes there ready to go, and boom, that was it. Just busted. So let's go ahead and rewind that video, put the pus back, and let's watch it in slow-mo. There it goes. And here we go, slow-mo pus. Yeah, that's a pretty big abscess and a pretty good amount of pus there. Okay, so we're going to get back to normal here. I'm just going to kind of continue to explore the area and make sure I haven't missed some little pocket of pus. And then after that, we'll go and take the tooth out. What's that?
Just one culture?
Yeah, just one culture. Got a good chap there.
I just don't want them to rest.
Okay, there we go. Thanks. Okay, so here's that famous finger sweep that everybody either loves or hates. I'm just making sure I didn't, leave any pus behind. Now we're going to use one of these rags. Remember, those are laparotomy sponges. That's what that thing's called. We're going to use one of those rags to just pack in the wound and, soak up any bleeding while we're taking out the tooth. That's a DeBakey forceps, that big tweezer thing. It's named after Dr. DeBakey, the famous heart surgeon from Houston. You can see the bite block in the mouth. You can see the endotracheal tube in the mouth. That's a Weeder tongue retractor that just went in there. We always just call it a sweetheart because it's kind of shaped like a heart. The part that's in the mouth next to the tongue is kind of shaped like a heart, so we just call it the sweetheart retractor. I'm using the Bovie electric cautery to make just a little incision in the gums, and then I'm using a 151 lower universal dental forceps, which is just a fancy way of saying some pliers to try and wiggle out that tooth. So a little piece of the tooth broke off. I just picked it up with the debakey. And now I'm going to go back to the forceps. I was asking the assistant to get me, excuse me, another dental elevator. But anyway, I'm going to go back to the forceps here, and I'm going to wiggle on that tooth. And you're going to see, yep, we got it out right there. And there is what's left of the crown of the tooth plus one of the roots. There's still one root in the bone. And I'm going to use the little small dental elevator that I asked for to get that out. And I'll show you a picture here. Yep, there's the picture. You got the ruler. That box with all the numbers is the sharps box. That's where we put each of our suture needles. And in a big case where you've got 50 sutures, you want to be able to count all the needles and make sure that none of them got left behind. So that's what that box is for. Thank you guys for watching. Please remember to like and share our video. And also please subscribe to the channel. That really helps us out. Special thanks to the patient as always. I really appreciate them letting us film. And if we can give you a hand, give us a call, 210-778-0002. Thank you.